All right, welcome to our next lesson. We are in the anatomy unit, and we've already done our support and movement where we looked at bones, joints, and tissues. We are moving on to different parts inside the human body, and the ones we're focusing on today are our respiratory system and our digestive system. We're going to get into our digestive system first. So here are some discussion questions that we have. What are the different parts of the digestive canal? So from the beginning all the way to the end, what are those different parts of our digestive system? How many of the organs are involved in the digestive system? And how do other organs help with digestion? Let's start with the first one. What are some of the different parts of our digestive? When we look at our digestive system, what do we see that we know?
The colon,
Yes, the colon. Very good. Yep.
the stomach,
Yep, the stomach. Anything else? Any other parts? Any other parts? We got stomach, colon. Anything else? Otherwise, these are all organs. How many organs are involved? Do we know any of these other organs that we see in the picture? Any guesses of what they could be?
is that the liver?
This is the liver that is involved in the digestive system. The liver does a lot of different things, and it helps with the digestive system. That's one of the things it does do.
So the mouth as well?
Yes, the mouth. Yep, that oral cavity, right?
The throat.
Yep. We see the throat, and we have different scientific words for the throat because we also have different, right? We have air and food. Do those go through the same place?
No.
No. Is there? And there's something that separates those two too. So we're going to look at all those things that are going on there in the throat there. And then how do other organs, so like the liver was something we talked about, right? That it's not necessarily, its primary function is not digestion, but it does help. What does the liver do to help us with digestion?
It's like a filter?
Okay, yeah, I guess you could argue that because like we're looking at the whole body, right? So it's like we eat the food, we digest the food, we get all of those good things, all those nutrients enter our blood system, and then the liver kind of filters it out, right? And it filters out the bad things, it filters out the things we don't need. It does kind of act a little bit like a filter. But that's like filtering our blood system. I think our kidneys do the same thing, but that's more when we get to the circulatory system. When we're looking about the blood, we'll really talk about the liver and the kidneys as filters. What else? Do we know any other organs? The liver is one. Do we know there's actually, I think there's 3 of them. There's like this little thingy right here, and then there's this thingy that like shoots out this way. Well, we will get into it. We have a video that we're going to start off with. So here's our video, and let's listen to the different parts. These are the questions that we're listening for. We're listening for the different parts of the digestive system and like what are their jobs, what are their functions. Let's listen.
Our digestive system is made up of a series of organs that allows our body to get the nutrients and energy it needs from the food we eat. Digestion starts in the mouth, where chewing and saliva breaks down food so it is more easily processed by your body. Once you swallow, the food enters the esophagus, which is a muscular tube that connects the pharynx, or throat, to the stomach. The esophagus contracts as it moves food into the stomach. A valve called the lower esophageal sphincter, or LES, is located just before the opening to the stomach. This valve opens to let food pass into the stomach from the esophagus, and it prevents food from moving back up into the esophagus from the stomach. Next is the stomach, an organ with strong muscular walls. It holds the food and mixes it with acid and enzymes that continue to break the food down into a liquid or paste. Almost 20 feet long, the small intestine, also called the small bowel, is the workhorse of the digestive system. It will continue to break down food with enzymes released by the pancreas and bile released from the liver. It is made up of 3 segments: the duodenum, which continues the breakdown of food, and the jejunum and ileum, which are mainly responsible for the absorption of nutrients. Aiding the digestive process is the pancreas. Among its other functions, the pancreas helps digestion by producing digestive enzymes and secreting them into the duodenum, the first segment of the small intestine. These enzymes break down protein, fats, and carbohydrates. The liver is another organ with many functions. Its main responsibilities in the digestive process are to make and secrete bile, and to process and purify the blood, which contains newly absorbed nutrients that are coming from the small intestine. Bile has 2 main purposes: to help absorb fats and to carry waste from the liver that cannot pass through the kidneys. Bile made in the liver travels to the small intestine through bile ducts. If the bile isn't needed immediately, it is stored in the gallbladder, which is a pear-shaped reservoir located just under the liver. The gallbladder sends this stored bile into the small intestine to aid in the digestion of food. Next along the journey is the colon, or large intestine. It is a 5 to 7 foot long muscular tube that connects the small intestine to the rectum and is responsible for processing waste so that defecation is easy and convenient. The rectum is an 8-inch chamber that connects the colon to the anus. The rectum receives stool from the colon, sends signals to the brain if there is stool to be evacuated, and holds stool until evacuation can happen. The last part of the digestive tract, the anus, consists of pelvic floor muscles and 2 anal sphincters, internal and external. Together, their jobs are to detect contents in the rectum, determine whether the contents are liquid, gas, or solid, and then control when stool should or shouldn't be excreted from the body. It's useful to understand the digestive system and the role it plays in your overall health and well-being. Knowing where to go when conditions of the digestive system affect your health and well-being is just as important. The University of Michigan Health System.
All right. So, looking at our digestive system, I'm going to go back to our last question and those other organs. Did we hear any organs that we didn't talk about before? We talked about the liver, but there were 2 others that they mentioned. Did we catch them?
The pancreas.
Yes, the pancreas. Very good. That is very vital for our digestive system, especially for breaking down sugars.
They did mention the brain.
Oh, the brain. Yeah, absolutely. I mean, that is true. I mean, the brain is like our control center for our entire body, right? That the cerebral cortex sends all of those messages telling the body what to do, right? Without that, our body wouldn't function. None of those systems would work without the brain sending it those subconscious messages to do what it needs to do, right? That our brain is in charge of everything. That is true. We had 2 of them right in here. So the pancreas is one. There was another one that's like a greenish shaped one called the gallbladder. And we will look at that today too. 3 words that kind of jumped out to me that I heard her mention a lot. One was nutrients. Nutrients, what are nutrients?
The good stuff.
Yes, right. It's everything that we need, right? The proteins, the oxygen, all of the stuff that we need. When we're talking about food specifically, I mean, calcium, sodium, the carbohydrates, the proteins, all of those stuff, the good stuff that we need for our body to function and to be healthy. Yep. I also heard enzyme. What does that mean? Enzyme.
It has something to do with breaking down
Mm-hmm.
food.
Yes.
Nope.
So, yep. And so enzymes are like an acid, and we have different types of enzymes that break down different types of foods. And in one of the homework assignments today, that can be a challenge that you look at the 3 different enzymes and what they target. We have one enzyme that specifically targets like carbohydrates. We have one enzyme that specifically targets sugars. We have another enzymes that target fatty proteins like from meats, and different parts of our body produce different enzymes to break down different types of foods. That's why we need this like whole team working together. For example, if we think about sugar or our glucose, which organ produces an enzyme for us to break down sugar, to digest sugar? Do we know?
Is that the pancreas, right?
That is the pancreas. And that's where when we talk a lot about diabetes, when someone has the different levels of diabetes, the pancreas isn't functioning properly. They're not producing that insulin to break down those sugars, that the body isn't producing that enzyme to break down those sugars. And so we have many different enzymes, and organs produce different types of enzymes. And one of the challenge activities that you don't have to do, but if you want to push yourself, is to look into those 3 different enzymes and what organs produce which enzymes. The other word that stood out to me was stool. She mentioned that a lot towards the end. What does that mean, stool? I mean, I always thought this was a stool, right? But that wasn't what she was talking about.
Feces.
Yes, exactly. Poop. Yep. Feces, fecal matter, poop, bowel movement. For some reason, we have like 10 different words for the same thing. I don't understand why we can't just like agree on one word. But culturally, it seems like one of those topics that we don't want to talk about. So we have all these different ways of describing it, right? Oh, it could be a BM, a bowel movement, poop, feces, fecal matter. All of them, they mean the same thing. So stool. Exactly. All right, so let's dive in a little bit deeper. We're going to look at each of these parts a little bit closer, specifically focusing on the form and function. What is it made up of? And then how does it work? What job does it do? So starting with our mouth and oral cavity. I have someone read for us about our mouth, the oral cavity. Who would like to read?
I can do it.
Okay, go ahead.
The mouth is the beginning of the digestive tract. In fact, digestion starts before you even take a bite. Your salivatory glands get active as you see and smell that pasta dish or warm bread. After you start eating, you chew your food into pieces that are more easily digested. Your saliva mixes with the food to begin to break it down into a form your body can absorb and use. When you swallow, your tongue passes the food into your throat and into your esophagus.
Exactly. And this is where, again, we're talking about that idea of enzymes, right? That even from the very beginning, before the food even hits your mouth, your body's already starting to produce enzymes preparing for that digestion. Like, yes, we're getting ready in the mouth with those saliva glands. One of those 3 types of enzymes you could read about is the one that's produced in the saliva. And you have to decide, is that to digest proteins, to digest carbohydrates, or to digest sugars? So that's the oral cavity. So we have the food in there. We're going to chew it. The scientific word for chewing is masticate, because it's your mandible. So we're masticating the food, breaking it down, and that's our first step of the digestive process. Then we move to the esophagus. Who would like to read about our esophagus?
I can.
Okay, go ahead.
Ring-like muscle at the bottom of your esophagus called the lower esophageal sphincter has to relax to let the food in. The sphincter that then contracts and prevents the content of the stomach from flowing back into the esophagus. When it doesn't, and these contents flow back into the esophagus, you may experience acid reflux or heartburn.
Yes, absolutely. And so that is a common problem that a lot of people have, especially as we get older, is this idea of acid reflux and heartburn, right? It's that stuff going back up and passing those valves where it shouldn't be. So that is our esophagus, which is that tube. It is very muscular, right? That it actually like squeezes and pushes that food down. All right, let's keep reading. Here's our second part of the esophagus. Who would like to read this?
I can do it.
Yep, go ahead.
Esophagus. Located in your throat near your trachea, windpipe, the esophagus receives food from your mouth when you swallow. The epiglottis,
The epiglottis.
epiglottis is a small flap that folds over your windpipe as you swallow to prevent you from choking. When food goes into your windpipe, a series of muscular contractions within the esophagus called peristalsis
Yep.
delivers food to your stomach.
Yeah. And so the epiglottis is that little flap that separates food from air, right? So if we're taking in food or water, that goes down our esophagus. If we're wanting to breathe in air, the air is going to go down through our windpipe. And so that the epiglottis is actually that little flap that kind of switches between that. And that's what happens when, I'm sure it's all happened to you, where it's like you went to drink something or to eat something, but you breathed in at the same time and it went down, and then it creates this like coughing, uncontrollable pain, right? Because it went down the wrong pipe into the lungs.
So what would happen if you swallowed a bubble and it popped inside you? Would that be painful or dangerous?
A bubble?
Like of any sort.
Like a soap bubble?
Like the air inside, I don't know.
I mean, I don't think a soap bubble would be harmful at all, right? Because I mean, it like bubbles kind of like implode on themselves. You know what I mean? Like bubbles don't actually, right? Bubbles go, right? They.
Yeah.
But I mean, one thing is that these organs are very, very tough, right? I mean, they are like, if you actually look at them, they're like ribbed, very muscular, and it's strong. Like it's a really, really strong muscle. It is designed to have some wear and tear, right? Like these are really, really strong muscles, and it is really kind of hard to damage them. Now you can, but also like it's designed for some pretty rough stuff that if we like accidentally swallow something too big or too rough, I'm sure we've all had that, you know, where it's that pain, right? Where you feel it and it's like, oh, right. And it's those muscles really trying to work that down into your stomach. It can do it. I mean, people do choke on things, right? That things do get lodged in there. And that's when we need to do like the Heimlich maneuver. Or if something is super lodged and we can't get them air, they have to cut a hole into the trachea itself to allow oxygen into the lungs. But those are pretty like very severe situations. I hope that answered your question, but a bubble definitely wouldn't affect it. And I mean, these muscles are very strong. So that's the esophagus. So we're going down the esophagus and now we're going to land into the stomach. So here's the stomach. Who would like to read this passage on our stomach?
I can do it.
Okay, go ahead.
The stomach is a hollow organ or container that holds food. While it is begin mixed with stomach enzyme. The enzymes continue to process of breaking down food into usable form. Cells in the lining of stomach secrete a strong acid and powerful enzymes that are responsible for the breakdown process. When the contents of the stomach are processed enough, they are released into the small intestine.
Very good. And when talking about enzymes, like I said, the activity today that you'll have is you have to identify 3 different enzymes and what's producing them. Some organs actually produce all 3 of them. And I think the stomach is one of them, right? The stomach has all of these enzymes, all of these acids, right? Ready to break down all those different types of foods. And so some organs produce more than one type of enzyme. Some organs mainly just produce one. like for example, the pancreas, right? The pancreas is really focused mainly on sugar. And so those powerful acids. All right, so we're in the stomach. It really kind of digests lots of food. At this point, this is where a lot of the nutrients then enter the body, right? That it's, oh, not, no, I take that back. This is not when the nutrients necessarily enter the body. We're getting there in the small intestine. This is where a lot of the really important stuff happens. Who would like to read this one?
I can.
Go ahead.
3 segments. The duodenum. I don't know how to say
Yeah,
it.
duodenum. Yep, the duodenum, the jejunum, and the ileum.
Yeah, that the small intestine is a 22-foot long muscular tube that breaks down food using enzymes released by the pancreas and bile from the liver. Persistalis also works in the organ, moving food through and mixing it with digestive juices from the pancreas and liver.
Very good. So this is one of our key root words, one of our Latin words that whenever we have a scientific term dealing with the small intestine, it often has the ileum in front of it. And we'll look at a few scientific words. So if we see ileum, we know, ooh, that is talking about the small intestines. We have colon, which is our large intestines. The ileum is the small intestines. All right, let's keep reading. Here's our next paragraph. I'd like to read this one. The duodenum.
I can do it. Small intestine. The duodenum is the first segment of the small intestine. It is large, responsible for the continuous breaking down process. The jejunum and ileum lower in the intestine are mainly responsible for absorption of nutrients into the bloodstream.
Yep. And so this is when all that good stuff is going into our body, right? That it's entering our blood system, and then our circulatory system is carrying it around to all the different parts of our body, to those cells. All right. And then our last passage about the small intestine.
I can do it. Contents of the small intestine start out semi-solid and end in a liquid form after passing through the organ. Water, bile, enzymes, and mucus contribute to the change in consistency. Once the nutrients have been absorbed and the leftover food residue liquid has passed through the small intestine, it then moves on to the large intestine or colon.
Very good. All right, so we have these words here: bile, enzymes, and mucus. All three of these are a little bit different, but very similar. Enzymes is that acidy material that we were talking about. Bile is also used to break down food too. It is produced, when we talk about bile, I really think of the gallbladder, that the gallbladder is the producer of bile. It's this like greeny substance that really kind of helps break down that food. And then mucus is, I don't know how to like scientifically explain mucus, but yeah, but like saliva, right, in our mouth, that it's that liquidy, it's not water, it's what our body produces as kind of like lubricant and helps break down things as well. So we have bile, enzymes, and mucus. All right, so we've moved now into the large intestine, our colon. And this is where a lot of people that have health issues with, it's often with the colon, right? We hear terms like colonoscopy, where they're actually going in and taking pictures of a person's colon, right? That this is often where a lot of issues happen, where we're having to do surgery. And colon cancer is often very common too. So let's read about the colon.
The large intestine, or colon, is responsible for processing waste so that emptying the bowels is easy and convenient. It's a 6-foot-long muscular tube that connects the small intestine to the rectum. The large intestine is made up of the cilium, the
Yes.
ascending colon, the transverse across colon, the descending left colon, and the sigmoid colon, which connects to the rectum.
Yep. So we go up and we go over and then we go down. Up, over, and down. All right, next section. Who would like to read this passage?
Stool or waste left over from the digestive process is passed through the colon by means of peristalsis, first in liquid state and ultimately in a solid form. As stool passes through the colon, water is removed. Stool is stored in the sigmoid colon until a mass movement empties it into the rectum once or twice a day.
Yeah. So it stays here in this section right there. All right, and then our last bit about the colon.
It normally takes about 36 hours for the stool to get through the colon. The stool itself is mostly food debris and bacteria. These good bacteria perform several useful functions, such as synthesizing various vitamins, processing waste products and food particles, and protecting against harmful bacteria. When the descending colon becomes full of stool or feces, it empties its contents into the rectum to begin the process of elimination, a bowel movement.
Absolutely, very good. And when we're talking about this idea of good bacteria, that's where, when we think about antibiotics, and one of the major side effects of antibiotics is constipation, right? They always tell people that when you're taking antibiotics, it can often lead to constipation because those antibiotics are killing all bacteria, good and bad, right? And so what is one way that we can get some of this good bacteria back into our system if someone's taking a lot of antibiotics? What do they recommend?
Probiotics.
Yes, probiotics. And where can you get probiotics? What foods can we eat?
Yogurt.
Yep, yogurts are really good.
Coffee. I don't know.
Ooh, coffee, I don't think so. No, I don't think there's probiotics in coffee because probiotics will be things that have been fermented, that they put a bacteria into it, kind of like alcohol, right? So beer and wine have been fermented, right? We put this living organism, yes, that has probiotics in it too. A lot of those fermented drinks that are really popular right now too, and people talk about good probiotics, that drinking these fermented cabbage, so like kimchi, any of those fermented items that are in like a liquid that we've introduced bacteria to break down that food, all of that would have good, healthy probiotics in it. And so that's something to be aware of too. All right, moving on. So it's in the colon. We're ready to get rid of all of this stuff, right? Let's get this out of our system. How do we do that? We have two stages. First one is our rectum. Who'd like to read about our rectum?
I'll do it.
Okay.
Rectum. The rectum is a straight 8-inch chamber that connects the colon to the anus. The rectum's job is to receive stool from the colon, let you know that there is a stool to be evacuated, poop out, and to hold the stool until evacuation happens. When anything, gas or stool, comes out in the rectum, sensors sensors send the message to the brain. The brain then decides if the rectal contents can be released or not. If they can, the what's this? The
Sphincters? Sphincters, yep. The sphincters
relax.
Mm-hmm.
The sphincters relax and the rectum contracts, disposing its contents. If contents cannot be disposed, the sphincter contracts, contracts and the rectum accommodates so that the sensation temporarily goes away.
Yep, absolutely. All right, any questions about that? All right, so then our last stage is then evacuating all of that, having our BM, our bowel movement. All right, who would like to read?
I'll do it again.
Okay, go ahead.
Anus. Anus. The anus is the last part of the digestive tract. It is a 2-inch long canal. Is it canal?
Canal.
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 Canal. Canal consisting of the pelvic floor muscles and the two anal
Sphincters.
sphincters, internal and external. The lining of the upper anus is able to detect rectal contents. It lets you know whether the contents are liquid, gas, or solid.
Excellent. Perfect. Sphincters. And these are these like, they're kind of like almost like rubber bands. Like they're these little round muscles, and we got two of them, and they can contract that way. All right, we got two more paragraphs.
I can do it.
Go ahead.
The anus is surrounded by sphincter muscles that are important in allowing control of stool. The pelvic floor muscle creates an angle between the rectum and the anus that stops stool from coming out when it's not supposed to. The internal sphincter is always tight except when stool enters the rectum. This keeps us continent, prevents us from pooping involuntary when we are asleep, otherwise unaware of the presence of the stool. Thank God.
Yeah, but this is actually a lot of patients actually struggle with this problem, especially elderly too, right? That as we get older, a lot of people lose that control of the sphincters, or the sphincters start to malfunction and they actually become incontinent, meaning they cannot control their bowel movements. And we see that a lot in nursing homes, and what's actually going on with that internal and external sphincter. All right. So moving on to our 3 axillary organs. So we talked about these other organs, right, that aren't, the food isn't necessarily passing through them, but these are vital for digestion. We have these 3 organs here. What are the organs?
Gallbladder.
Yep,
Pancreas.
our gallbladders, pancreas, and
liver.
our liver. Very good. Yep, and we're going to look at all 3 of those a little bit closer. Let's start with the pancreas. It kind of looks like an ear of corn, doesn't it? It looks like an ear of corn. I'll never think of my pancreas again, or or an ear of corn. I'll look at an ear of corn. Exactly. All right. Who would like to read about our pancreas?
The pancreas. The pancreas secretes digestive enzymes into the duodenum that break down protein, fats, and carbohydrates. The pancreas also makes insulin, passing it directly into the bloodstream. Insulin is the chief hormone in your body for metabolizing sugar.
Very good. Absolutely. And that's key. That is like one of its main purposes, the pancreas, is this idea of controlling our sugar level, right? That when we eat, our sugar level increases because pretty much everything has sugar in it, right? Everything that we're eating has those carbohydrates and those sugars. So after every meal, our blood sugar increases. So then our body automatically produces the right amount of insulin needed into our blood system, and then that sugar level comes back to normal. And we saw that during our homeostasis unit, right? That as something changes, the body reacts to bring it back to that normal level of homeostasis. And insulin is that key factor. And people with diabetes, this is not functioning properly, right? So they really have to control what they eat. They have to monitor what they eat. And then they have to then monitor the amount of insulin they're manually putting into their body, because their pancreas isn't producing the insulin that's needed. And so that's why you see individuals with that have diabetes are often on low sugar diets, low carb diets. They do a lot of things that are sugar free. So they'll use Splenda, they drink diet sodas, anything that has sugar free in it, they don't have to necessarily worry about because that's not affecting. But anything else that has sugar, they then have to constantly monitor what their current blood sugar level is and then how to respond to it by manually inserting that insulin. All right, so that is our pancreas. Next one is our liver. Who would like to read about our liver?
The liver has many functions, but its main job within the digestive system is to process the nutrients absorbed from the small intestine. Bile from the liver secreted into the small intestine also plays an important role in digesting fats and some vitamins.
Yeah, absolutely. So it is helping there. And so like I was saying, we talked about the liver acting as a filter, and it does, but when we talk about filtering, it definitely is more filtering on the circulatory system of like filtering our blood and keeping the blood system clean and going well, not necessarily in digestion. All right, next part of liver, here's our second paragraph.
The liver is the body's chemicals factory. It takes the raw materials absorbed by the intestine and makes all the various chemicals the body needs to function. The liver also detoxifies potentially harmful chemicals. It breaks down and secretes many drugs that can be toxic to the body.
Mm-hmm. Yeah. And this is where no, we're going to talk about that next week when we talk about the circulatory system. All right, and then the gallbladder is this green one right here. Let's read about the gallbladder. Who would like to read?
The gallbladder stores and concentrates bile from the liver and then releases it into the duodenum in the small intestine to help absorb and digest fats.
Yep, absolutely. So that is our digestive system at whole. We looked at the form of those different organs, the function of all of them. For our activity today, for this week, you will have to label these different organs. So I'll show you a picture and you have to label which one's the liver, which one's the gallbladder, which one's the pancreas, which one's the colon, which one's the small intestine. And you have to label all those different parts. And then there'll be another section that talks a little bit about their function of what they do and matching what is going on in those different parts of the digestive system. All right, any questions about that so far before we move on? Is all good? All right, we're going to move on to medical issues. So these are all medical terms that have to deal with the digestive system that we're working with. The first one, emesis, is the scientific word for vomiting, right? So that is vomiting. And we see that heartburn we talked about too, or acid reflux, which is that valve not necessarily working, and those acidy chemicals, right, that are used to break down the food is actually entering up into the pharynx, into the body there, causing that pain and discomfort. These three terms have to do with diabetes. Well, kind of. We have hyperglycemia. What does that mean? Hyperglycemia. We know the word hyper. Do we know glucemia, like the word glucose?
Like too much sugar?
Yes, exactly. So glucose is the scientific word for sugar. So we see glycemia has to do with sugar, hyper meaning above. So our blood sugar level is too high, right? So if the person will be really have like all of this energy and it's like, it's hard to think, concentrate, that hyperglycemia. If we see hypoglycemia, what would this mean?
Low.
Yes, it's below. And this we would see an individual often pass out. If their blood sugar level is too low, they can faint, they can pass out, they become inactive. And that's where working with a patient that is diabetic, where their blood sugar level is fluctuating and their body, their pancreas isn't controlling it, we have to realize where are they, because our actions will be different. If someone has hypoglycemia and is passing out, we don't want to be giving them insulin. That would actually be devastating. What we need to do is actually increase their blood sugar level. And how can we increase a person's blood sugar level? Quick and easy way.
Eat something.
Yes, specifically something sweet, right? So like a piece of candy, piece of chocolate. Let's get something high in sugar right into their system, and that'll often make them feel better, right? So if we're seeing someone passing out or exhausted because their blood sugar level is too low, we need to get sugar into them. If we see the opposite, right, where we take their reading and their blood sugar level is really, really high, that's where we need to manually insert the insulin to bring that blood sugar level down. And then
So
that
do
is,
the
Mhm.
so do the hypoglycemic people, they don't need the insulin then?
Correct. Hypoglycemic people. So there are some individuals, especially some athletes, right, that are in really, really good shape and their metabolism is super, super, super fast. If they're not eating enough, they can become hypoglycemic because their body is used to burning so much energy that if they didn't get the sugar that's needed, their blood sugar level can get really low and they can feel really sick. They can feel faint. They can feel weak. And that does happen with athletes.
Interesting.
Mm-hmm. And so that is not, and that's why I said it's kind of related to diabetes. There can be a person that has hypoglycemia, but they're not diabetic. That has to do with their digestion and how quick their metabolism is and how quickly they metabolize food. And if their body is metabolizing the sugar too quickly and their body doesn't have enough sugar, they need to do something, which is
Maybe
often eat, right?
they're just hungry.
Yeah, yep, they're just hungry. There are some people, though, that this is a condition for them. They do have hypoglycemia, and it's because their metabolism is so quickly that they have to be very aware of it, that they always have to have like a little bar of chocolate or candy or something with them, because if they start feeling faint and weak, they know they need to eat something. And that has nothing to do with the pancreas. Well, sometimes it is. Sometimes hypoglycemia can be caused by the pancreas producing too much insulin, right? That if the body is producing too much insulin, the blood sugar level is going to decrease and it's going to get dangerously low if there's too much insulin in the body. So that can be a pancreas issue as well. And so this is monitoring that blood sugar level. Next one we talk about is jaundice. Have we heard that before? Jaundice.
I've heard about it before.
It has something to do with the yellow skin.
Yes, yep, that's one of the signs of it is the yellow skin, and it's actually the liver that is misfunctioning. It's kind of the warning signs of liver disease, right? We see the eyes getting really kind of white and milky, and then the skin getting really kind of yellow. Unfortunately, this is kind of one of my jokes, though, is that if you go inside of a hospital, the lights are often so bright and so yellow, we all look like we have jaundice, don't we?
Yeah.
It's like, how do you know? Because we all look yellow. And so, yes, jaundice is one of those the early warning signs that there's liver problems. All right, stomach ulcers.
Is that like herpes inside the stomach? No.
Yes, yep, that we're getting this like sore, this opening inside of the stomach wall, that there's actually like a hole developing inside the wall of the stomach. Absolutely. Gallstones. What are gallstones?
I heard about it, but I don't know how they are. One of my friends had her gallbladder removed because of the stones.
Because of the stones. Yep.
Yeah.
So we have our gallbladder, which holds all of that bio, right? That helps us with the digestive system. And gallstones are often caused by high levels of cholesterol. So if someone has a diet that's high in meats, specifically red fatty meats, and they have a lot of animal byproducts, they're eating lots of cheeses, lots of meats that are high in cholesterol, they can actually create like these little clusters, these like crystallizations, like these little chunks of cholesterol inside of it, which then are those stones, which stops it from functioning properly. And there's a few treatment options depending on how severe it is. Sometimes they can actually send something in and actually break them up and kind of break those up, and then it's fine. If it gets bad enough, it gets to the point where they do have to actually remove the gallbladder itself, like what your friend did. Yeah. So those are gallstones, which is common. And then we have two other digestive disorders. These fit under mental health, someone's mental health. We have two terms. We have bulimia and anorexia. What are those?
Throwing up and not eating.
Yes, exactly. And so throwing up, but it's more than just throwing up, it's forcefully throwing up, right? They've eaten food and they force themselves to purge. They force themselves to have emesis so that they're not actually getting the nutrients, right? Because a lot of times it is listed as mental health because the individual feels that they're overweight or they're not pretty enough, and that that they want to lose that weight and become thinner because they feel they're fat and unattractive. It affects both men and women. I think there's kind of a stereotype that's like, oh, that's something women do. There's actually men that do it as well too. And then anorexia is that idea of not eating. That is just, I'm not hungry, I'm not going to eat, and not eating. And so this is something to be aware of too, as medical providers, kind of going back to our lesson where we talked about requirements for human life, right? That as healthcare providers, you are looking at the whole package, right? The whole thing, not just their physical health. And mental health is becoming very, very popular and prevalent in healthcare providers now. And so as CNAs or as nurses, are you seeing warning signs of bulimia or anorexia? Like, do they eat the hospital food and you notice that every time they eat, they're then going to the bathroom and you hear them vomiting, right? Like, are there warning signs that you should mention to the doctor or the social workers or the psychiatrist to come in and just to kind of check things out and see what's going on? But those are two terms as well, bulimia and anorexia. Any questions about our medical issues? Otherwise, our CNA terms, we have these terms here. I think we should know most of these terms here. We have constipation, we have defecation, dehydration, diarrhea, and fecal impact. Fecal impact is kind of like constipation, right? It's this like blockage that it's gotten really hard and it's blocking that. There's a fecal impact inside the colon there or in the anus, stopping a bowel movement. So it's linked to constipation. Any questions over these words? We good?
Mhm.
Or something we don't know?
Dehydration is when a person don't drink enough water.
Yes, correct. Yep. Because we have hydro as our root word for water. If we ever see hydro in a word, it often has to do with either water or hydrogen. And the reason why water is because water has hydrogen, H2O, right? There's that hydrogen and oxygen. So hydrogen is water. So D is the opposite. So no water in the system, dehydration. If someone is hydrated, they have lots of water. Dehydrated, not enough water. Other questions over these words here? Okay, next one. These are two medical treatments that we have with the digestive system, specifically from the colon, where we're entering something through the anus into the colon because it can enter it can like help with the digestive system. That's like the best way to get medicine there. Or it's also a really quick way to get things into the blood system as well too, if we're not using an IV. And so we have an enema and we have a suppository. Have we heard these terms before?
Suppository is more like a pill form, right?
Correct. Yep. Suppository is a solid object, right? So it's something solid that might dissolve, or it's something that's solid that we're putting up into the colon. Enema is going to be a liquid.
Either
Yeah,
walk.
enema. I think enema is the one who's holding. The body is holding water inside, and your feet is being swollen, something like that. You're being swollen for enema.
Yeah, an enema is when we're entering liquid through the anus into the body. And so, like, for example, someone might be having an appendicitis, right? That their appendix is swelling and they're trying to get a really good picture. They're going to do a CAT scan of the digestive system to see what's going on there. And so what they'll often do is they will use a liquid, an enema, and they will force a liquid through the digestive system to make everything nice and swollen so they can take really clear pictures with their MRI. There of the digestive system. And so they introduce a liquid, right? They put a liquid up into the digestive system, and it's quicker to do it rectally through the anal than to have the person drink and drink and drink and drink and wait for it to get into the system. So yeah, these are both medical procedures where we're inserting medicine or some type of something into the body, and we're doing it rectally. All right, and then other scientific words here. Stomy means to cut a hole. It's a scientific word to cut a hole, like having an operation. And so we have colostomy is cutting a hole into the colon itself, right? If they're having to do a colostomy, they are cutting a hole into the colon itself. What is an ileostomy? I told you ileum, right? What was our ileum? Do you remember? What is our ileum? Our ileum is our small intestine, right? There are three parts of our small intestine. The ileum is the big part. And so most scientific terms that are dealing with our small intestine, you see that science root word of ileum. So an ileostomy, what would an ileostomy be?
Cutting the small intestine.
Yes, that they're having to cut into the small intestine. A colonostomy is cutting a hole in the colon. Yep. And so that is, if we ever see ostomy at the end of a word, we know it means that they're cutting into it. So we have our colon, our small intestine, and this is just the scientific word for cutting a hole, for operating, right? They're having to cut a hole into something. So they can either like remove stuff manually, like if there is some problem with the colon, they might actually have to cut a hole and actually remove all of the fecal matter manually, kind of like a catheter does that for urine. They can do that for your large intestine as well too. So that is the scientific words here. All right. And then abbreviations. The big ones for the CNA training, BM for bowel movement, and GI is gastrointestinal, which is the scientific word for what we're talking about. That lower part of the digestive system from the stomach down is your gastrointestinal. All right, any questions about our digestive system? Are you ready to move on to our respiratory system? Ready?
Yep.
Let's move on. So here's our respiratory system. What do we breathe in and out? How many times do we breathe in a day? Which organs are members of our respiratory system? And what stops us from not breathing in food or water when we eat or drink? What was that little flap called again? Do we
Sphincter.
remember? Nope, not the sphincter.
Sphincter,
No,
not sphincter.
the epiglottis. The epiglottis is that flap that switches between air and food and water, right? So it's going down the right pipe. All right. Let's take a let's answer some of these questions. What do we breathe in and out?
Oxygen.
Are you sure? Just oxygen? Breathe in and out.
Oh. Oxygen, breathe out.
Carbon monoxide.
Oxygen.
Ooh, I heard carbon monoxide. So carbon monoxide, mono means one. So CO is carbon monoxide, only one oxygen, CO. And that's what cars produce, right? This is a pollutant in our atmosphere, carbon monoxide. Carbon dioxide, di meaning two, CO2 is what we breathe out. We breathe out carbon dioxide. Carbon monoxide is cars. This is a pollutant. So carbon dioxide is what we breathe out. Exactly. So we're breathing in oxygen, we're breathing in carbon dioxide. Yes, but it's more complicated than that. We're not actually just breathing in oxygen. If we actually look at our atmosphere, there is nitrogen, there's argon, there's a bunch of things in air. And that's where when we have someone on oxygen too, it's not just oxygen. Right? There are other gases in our atmosphere that we're breathing in. It's more than just oxygen. And some of the things that we breathe in is actually CO2 too, because there's CO2 in our atmosphere. And when we breathe in, some of that is CO2 coming into our body. And when we breathe out, it's mainly CO2, but some of it's oxygen too, right? So it's more than just oxygen and CO2, but that is the simple answer, right? O2, that oxygen, those two oxygen molecules is getting into our body. The CO2 is leaving our body. All right. How many times do we breathe in a day? Well, it depends if we fell in love or not. That's a joke. It was Valentine's Day last week, right? How many people got their breath, took their breath away? All right. So how many times do we breathe in a day? What do you think? If you had to put a number on it.
Maybe 1,000.
Maybe 1,000?
I think more.
I think infinity.
Infinity. Because we got 60 seconds in a minute, 60 minutes in an hour, and 24 hours in a day. And then think about in a minute, how many times you take a breath in a minute?
I feel like it's like more than 20,000 breaths in a day.
More than 20,000? All right, well, we'll watch a video that'll answer that question. Which organs are a member of our respiratory system? What do we see here in the picture? What do we got?
Lungs.
Yep, our lungs is the big one. We'll look at all those different parts there. And then what stops us from, we already looked at that, the epiglottis. All right, so let's watch our video.
In order to stay alive, the body has to breathe air. We breathe in oxygen and we breathe out carbon dioxide. This process is known as respiration. Breathing happens automatically. Every day, the body breathes about 20,000 times. By the time we reach 70 years old, that's about 600 million breaths. All of this breathing occurs because of the respiratory system, which includes the nose, throat, voice box, windpipe, and lungs. At the top of the respiratory system, the nostrils bring air into the nose, where it's filtered, warmed, and moistened. Tiny hairs called cilia protect the nasal passageways and other parts of the respiratory tract and filter out dust and other particles that enter the nose through the breathed air. Air can also be breathed in through the mouth. The two airways of the nose and mouth meet up at the pharynx, which is located at the back of the throat. The pharynx carries both food and air and is used for digestion and respiration. One path is for food. This is called the esophagus, which leads on to the stomach. The other side is for air. It's called the trachea. A small flap of tissue, called the epiglottis, covers the air-only passage when we swallow. This stops food and liquid from going into the lungs. The larynx, or voice box, is located at the top of the trachea, the air-only pipe. This is where our vocal cords are. The trachea, or windpipe, which is a 2 to 3 centimetre tube, then extends downwards from the bottom of the larynx for about 12 centimetres. The walls of the windpipe are made strong by stiff rings of cartilage that keep it open. The trachea is also lined with tiny hairs. They sweep foreign particles and fluids out of the airway, keeping them from entering the lungs. The windpipe divides into 2 branches, and each one of these enters one of the 2 lungs of the body. Each branch resembles the limbs of a tree, dividing into smaller, finer branches called bronchioles. The bronchioles end in tiny air sacs called alveoli, which look a bit like grapes. These structures enable fresh air to get to the air sacs, which are surrounded by tiny blood vessels, or capillaries. The oxygen passes through these air sacs and travels through the capillary walls into the bloodstream. At the same time, carbon dioxide transfers from the bloodstream into the air sacs, where it gets breathed out of the body. When we exercise, the body needs more oxygen to feed the muscles as they work harder. The body responds by breathing more quickly and deeply. As the cells of the muscles use up more oxygen, the lungs have to work harder to keep up the supply. The respiratory system then speeds up to supply the body with much needed oxygen, and also to get rid of the carbon dioxide waste in the system. Over time, exercising also helps our chest cavity to get bigger, which enables the body to increase the amount of air it takes in. More capillaries form around the air sacs, so the body gets better at swapping oxygen and carbon dioxide gases. We can see how the body's respiratory system helps the body to move about and is influenced by regular and ongoing physical activity as well.
So we got that number, 20,000, right? 20,000 times a day we're taking those breaths. And that what's interesting is he talked about it like it's often involuntary, right? We're not paying attention to when we breathe. And that's where a lot of mental health providers, that's one of the exercises that they have people do to reduce anxiety, to reduce stress, to calm people, is to focus on your breath, because we have the capability of focusing. It's all right, I'm going to breathe in, I'm going to breathe out. I'm going to breathe in through my nose, out through my mouth, and we can control it. And that has this power of centering people. But yeah, 20,000 breaths that we take. So yeah, we're going to look at all these organs and a little bit closer. So we're going to start with the mouth and the nose. Who would like to read about our mouth and nose?
Openings that pull air from outside your body into your respiratory system.
Yep, so that's where we're entering, right? Brings it in and out. Next one is the pharynx. That pharynx is that part on the back that both food and water and air is all going through in this part. Who would like to read our pharynx?
Throat, tube that delivers and nose to the trachea. Windpipe.
Very good, absolutely. All right, so then our next one is that trachea, that windpipe. Go ahead and read our trachea.
Passage connecting your throat.
We had 2 people in there. Go ahead, Eva.
Passage connecting your throat and lungs.
Very good. All right, so looking at our root words. What is a tracheotomy? We've talked about both these root words now.
Hole.
Yeah.
Yes.
Otomy hole.
Yes, right. They're scientifically cutting a hole, right? Scientists, the surgeons, the doctors are cutting a hole for some reason. A tracheotomy is cutting a hole into the trachea, specifically for air and oxygen, that if the windpipe ever gets crushed, or if something gets lodged or stuck in there, they actually cut a hole and bypass the trachea right in here to then get oxygen into the lungs by cutting a hole into the trachea and then putting a tube. We do that. So that's that scientific word, tracheotomy. We see otomy is cutting a hole. So we can start breaking those words apart. All right, so we have our trachea. Then those go into these tubes inside our lungs themselves called our bronchial tubes. Who'd like to read those?
I'll do it.
Okay.
Bronchial tube. Tubes at the bottom of your windpipe that connect into each lung.
Yeah, very good. So we see these tubes that go. All right, so we're getting bigger to smaller. Now we're going to get really small here. And look at the next three are all of these really small things. So first we have the bronchioles, which we don't have a reading, which are these really small ones, right? Then those lead to the alveoli, which are these little sacs, and they almost kind of look like grapes, right? Like grapes on a vine. Those are little air sacs that fill up with air. And then the capillaries is what this is talking about. Who would like to read about our capillaries?
Blood vessels in the alveoli walls that move oxygen and carbon dioxide.
Yes, absolutely. And I see two. I see red and I see blue. Do we know which one's oxygen and which one's carbon dioxide?
Oxygen is red.
Well, you'll have to wait until next week when we talk about the circulatory system. It's a trick question. It's to hook you in for next week. And so, yeah, so we have that blood system, right? And that's how we're swapping in the good stuff and the bad stuff. We're getting the oxygen and then it's releasing the carbon dioxide to breathe out, right? We're seeing that swapping of oxygen and carbon dioxide. Di meaning two. All right, and then our lungs is the overall thing. All of those parts make up the lungs, right? We have our bronchial tubes, our bronchioles, and then we have those alveoli sacs, and then the capillaries are those blood vessels. All of this together makes the organ that we call the lungs. Who would like to read our lungs?
I can do it.
Okay, go ahead.
Organs that remove oxygen from the air and pass it into your blood.
Absolutely, very good. All right, so we have two lungs. Question, are they the same size?
I think
They
so.
don't look like it in the picture.
Nope, they're not. One is bigger than the other. Do we know which side's a little bit bigger?
Left.
Nope. Well, sorry. That's perspective. Left looking or left for the person, right? Is it our left or the person's left?
The person's left.
The person's left, it is not correct. It's going to be the person's right side because the left side has our heart, right? Our heart sits right in there. And so it kind of, there's like this space for the heart, which then that means that lung is just a little bit smaller because it's made space for that heart. And so our right side's a little bit bigger. I think it's 3-2. I think there's 3 sacs to 2 sacs, I think.
Even though the left one looks bigger, it's actually smaller.
Yep. Misleading picture, I think. Well, let me look this up here. So it says, so the lungs are not equal in size. The right lung is shorter. Notice how this is shorter, right? Because of the liver. Because the liver sits high and tucked up under the rib cage. But the left lung is smaller because the space taken up by the heart. So the left side is smaller. It's longer, but it is smaller because of the space of the heart. But then the right side is shorter because of the liver being packed up right up in here. We learn things every day. I didn't know that. All right, other body parts with breathing. We often talk about the diaphragm and the ribs affect our respiratory system. What is our diaphragm? Do we know our diaphragm?
Does it help with our breathing?
It is a muscle that strips all the way across here that helps, like, right? It pulls to create that space to allow oxygen coming in, right? And then contracts. And so the diaphragm is a muscle in our stomach, or no, it's not in our stomach. Stomach is in like area, not the actual organ of the stomach, but it's there across our body, across our abdomen that helps us breathe. It's a muscle that helps us breathe. And then rib cage. Ribs kind of do a few things. What do the ribs do for our respiratory system?
They hold them together, everything together.
Yep, and it's kind of like protection, right? Because these are really important things, right? Our lungs, these organs, they're strong, but they're also very fragile. So we have this like bony structure with all of these muscles going around this, protecting everything on the inside. But the way our ribs are designed, they're not just solid, right? Our ribs and those muscles between them do this, right? They open up and then they close down, and they open up and they close down, and that then allows for that respiration to happen, for that breathing. And the way the ribs are designed are to help with that breathing in and out motion. All right, so that is our respiratory system. Medical conditions that we talk about. Allergies really affect the respiratory system, right? We're breathing in those pollens, we're breathing in those allergens that the body doesn't like, that it has that allergic reaction to, that can cause swelling, inflammation, phlegming, even death. If someone has like a really strong allergy, for example, like peanut allergies, some people are deathly allergic to peanuts. Asthma. What is asthma?
It has something to do with difficult breathing, but I'm not sure.
Yep, it does have to do with difficult breathing, and it's going to affect these here, the bronchial tubes and the bronchioles, is that they kind of get swollen. And so it makes them thinner, which allows less air to come through. And I've heard people describe that having asthma is kind of like breathing through a straw, right? It's just like it takes so much more work to get air in and so much more work to get air out that it's exhausting, because the tubes themselves have swollen and gotten thin. And that's why they have to use an inhaler, which is that steroid that like allows all of that to kind of expand and open up again, those muscles. And so that's asthma. Pneumonia. This is another root word for lung, right? If we see that, it's often dealing with the lungs. Pneumonia. What is pneumonia? Do we know pneumonia?
Is it like liquid in the lungs?
Yes, we have a fluid buildup. Yep, we're having this like liquid building up in the lungs, which stops the swapping of oxygen and carbon dioxide with the blood system. Yep. And that's why a lot of doctors will use the stethoscopes and actually check your lungs and have you breathe in and out, because what they're listening for is a clear lung, right? Is there any like rattling, any liquid type sounds in the lungs themselves, or are they clean? Bronchitis. Itis is another root word. If we see itis, do we know what that means? Itis. Itis means to swell, to get bigger. So we have all these things where things get bigger. For example, appendicitis, right? That it's swelling, it's inflamed. We have tonsils, your tonsillitis. If someone has a tonsillitis, their tonsils are swelling up. Bronchitis, what part of our body is swelling up?
Lungs.
The the bronchial tubes themselves are kind of swelling up, right? Which is causing pain and discomfort and difficulties breathing. So itis means swelling, inflamed, that something is wrong. So if we see itis at the end of the word, it's normally whatever that object is swelling up, right? Arthritis is the swelling up of our joints, a lot of itis. All right, and then influenza is our other medical issue. How does influenza affect our respiratory system? When people get the flu or a virus like a coronavirus, like we're talking about right now with the COVID-19, how does that affect the respiratory system? What happens?
By building up a
It's
mucus.
like they're having difficulty breathing.
Yep, so there's mucus, we're seeing liquids in there. It can lead to pneumonia. What did you say, Maurice? I didn't quite hear you.
It's like those things are making difficulty in breathing, like
Yeah.
something like that.
Yep.
Like there's
Yeah.
something block passage of breathing.
Yes, absolutely. It's making that breathing difficult. It's adding that mucus and that liquid inside the lungs. It's not allowing the oxygen, and it's not allowing the oxygen and the carbon dioxide to swap in the blood system. And that's why when patients have COVID-19, one of the things that they're checking is those oxygen levels pretty regularly to see, do we need to put them on a respirator? Do we need to be inserting more oxygen and trying to breathe for them? What is their oxygen level in their body right now? All right, so that is our respiratory system. Any questions about our respiratory system? Oh, that's the digestive system. Our respiratory system. Any questions about our respiratory system? Otherwise, the last thing I wanted to talk about really quickly was this idea of cigarette smoking. Good, bad, cool? What do you think, ladies?
Bad and uncool.
And bad and uncool. All right, why?
Disgusting.
Disgusting.
And it's bad for you.
And it's bad for you. How bad for you is it?
Pretty bad. You'll have long-lasting physical effects.
Yep, absolutely. They say, the CDC, so I have some statistics from the CDC, the Center for Disease Control. They say that smoking is the leading cause of preventable disease, right? There are all these diseases and illnesses that these people are actually causing to themselves by doing this activity, and that it is the #1 cause of preventable diseases that we could stop, diseases and illnesses that we have the ability to say, no, I don't want that, but we're making that choice. But is it really a choice? Is an addiction really a choice?
At the beginning, it sure is.
Or were they victims of catchy advertisements and like, oh, so cool, and my friends made me do it, and my parents made me do it, and my brother, was it really a choice?
To some point, it is.
Some point, yep. So here's some of our statistics. They say that 480,000 people die each year linked to smoking. And that is 1/5 of the deaths in the United States. 1/5 of the deaths in the United States are linked to smoking every year. 90% of lung cancer is also connected to smoking. 9 out of 10 people that have lung cancer also smoke. Some type of a connection there. And that we know that smoking increases heart disease, increases chance of stroke, and there's all of these increased diseases that these people could prevent. But
so it's linked to everything.
Yeah, it's linked to a lot of things. Yeah. But we're seeing this trend right now of people like, no, I don't smoke, I vape. What do you think? Better? Worse? Same
Same
thing,
thing.
different?
Same thing. You're still inhaling unnatural stuff into your body.
Oh, but it's vapor. It's not smoke. What do
It's
we
a
know?
different.
What do we know
It
about
might
You're
not be
still
smoke.
putting tobacco in there, right?
Still.
It's
vaping?
still
Yep. There's still nicotine, exactly, which
I
is an
read
addictive substance.
Yeah, I read something about the social media about the vaping thing. They start they are starting to discover some diseases that is linking about using a vape or
hmm
e-cigarettes.
Yeah. Absolutely. And so our homework assignment is for you to do a little bit of research. So I have some articles. I have one that comes from the John Hopkins Medical Research that says 5 vaping facts you should know. I have another article for you to read, said kids don't know the dangers of vaping and schools are desperate to educate. These two are clearly against the use of e-cigarettes. They are saying, hey, they're dangerous, they're bad for you. What's interesting about this one here is it's going to say that it's really not as bad as smoking. That is a true statement. Smoking is worse. But just because smoking is worse, does that mean vaping is healthy? It's less dangerous than smoking cigarettes,
Still
but
unhealthy.
is it still healthy, right? And so that's kind of the argument. But I have some other ones. These are additional articles. You don't have to read these articles, but if you want to, I really recommend them. This one is really interesting. It says more than a half of e-cigarette users want to quit. This one really says that, hey, these e-cigarettes are beneficial. They're these people that are breaking their nicotine addiction by using this less dangerous. I don't want to say safer. I don't want to say healthier, but it is kind of healthier, but it's more less dangerous than cigarette smoke. And it is helping them quit and live healthier lives. So is
just
it
a
bad?
step down from smoking, I guess.
Yes, but is it bad then, right? Is it bad if it's changing all of these people's lives and making them live healthier lives? And then the other one is youth smoking gaining popularity because of vaping? And that's something too that we're seeing more and more middle schoolers and high schoolers smoking, and the popularity of smoking is increasing because they're also vaping. And then there's that question, is vaping leading them to smoking cigarettes, right? Vaping is so cool, right? It's cool, and they think, oh, it's not really dangerous, it's not harming
And
me.
all
So
those
like,
new flavors.
but now I'm like, I'm more likely to smoke cigarettes. I have a nicotine addiction now. Where am I going to get my nicotine? Well, I could vape, but then smoking is cheaper. So I could just smoke a few cigarettes with my friends when I'm out at the bar. Is it increasing in popularity? Some people argue yes. So some interesting articles to read. Like I say, these two are actually assigned as homework for you to do. This one is just an online article to read, and then this is an article with 3 questions for you to answer. These are articles with questions. They are only additional. You can do them if you want. You don't have to, but I encourage they're interesting reads. At least read them if you don't do the questions. Good stuff. And that ends our lesson on the respiratory system and the digestive system. So let's look at the homework one more time before I let you go, ladies. So assignment 1 is the digestive system. You're going to label the parts of the digestive system and those different organs, and then link to some of their functions of what they do. We're going to do the same thing for the respiratory system. You'll have a picture and you have to label those different organs and say kind of what they do. And then we have our 2 articles over vaping. And how dangerous is vaping, really? How harmful is it? Questions to ask. All right, and then those additional readings, those 2 other ones are here and here that you don't have to do, but again, just more information, highly recommend reading them, good stuff. Here's a copy of our presentation slides. When I finally get the video recorded and edited, I will get it uploaded here at the top. All right, any questions for me, ladies?